You're probably wondering how I got here. Let me show you. I think you literally broke my leg.
Oh no!
Yeah.
Braden has a disease known as osteogenesis imperfecta, a disorder that mainly affects bones. Those born with the disease commonly suffer bone breakage, sometimes without cause.
Osteo means bone. Genesis means formation. And imperfecta means imperfect. Hence the name osteogenesis imperfecta, or imperfect bone formation.
Another commonly used name for this disease is the brittle bone disease, or OI. Both of these names are very self-explanatory. Brittle bone disease comes from the effect of fragile bones, and OI is short for osteogenesis imperfecta.
Most cases of osteogenesis imperfecta have an autosomal dominant pattern of inheritance. This means that one copy of the changed gene in each cell is capable of causing a condition. Many people with type 1 or type 4 osteogenesis imperfecta inherit this mutation from a parent who has a disorder. OI is not a sex-linked gene.
Chromosome 17 is what affects OI. Mutations in the COL, I2, and P genes cause this disease. This mutation provides the wrong instructions to produce collagen 1. This type of collagen is the most abundant protein in bone, skin, and other connective tissues that provide structure and strength to the body. It is not a non-disjunction.
There are 5 types of osteogenesis imperfecta. The most mild form is type 1, whereas the most severe is type 2. Every other type of severity lies between the two.
OI is highly uncommon. It affects about 6 to 7 people out of 100,000 worldwide. The most common types, 1 and 4, affect around 4 to 5 people out of those. Osteogenesis does not occur in a male or female more frequently, and it can occur in any ethnicity with none being more common. OI is a genetic disorder that runs in families.
If you're worried about getting this disease and don't know how to detect it, some risk factors include, but are not limited to, short stature, barrel-shaped ribcage, sclera that can turn a light blue within the eyes, and malformed eyes as well.
Vital organs can also be more easily bruised and damaged as a result of lack of bone protection, and infants born with OI can result in undeveloped lungs.
If you have any of these symptoms, it is important to get tested to see for sure what is happening. Some of this testing is done prenatally, which can detect OI at 14 to 18 weeks. Chorionic villus sampling can be tested for genetic mutation to possibly detect the disease. The last form of testing can be done on the skin by analyzing collagen or blood tests to detect the DNA sequence.
While there are no cures for OI, there are treatments, some of which include physical and occupational therapy, medications which increase bone mass, and in the case of bowing bones, surgery. It is difficult to name just one treatment as there are varying levels of severity among patients. Some of the most common causes of death from this disease come from respiratory failure and accidental traumas.
This disease seems pretty scary, but in actuality, the majority of children and adults with this disease live healthy and happy lives.
It can be difficult living with this disease, so if you're in search of a support group, there is one, and it's known as the OI Foundation.
The main goal of this foundation is to improve the quality of life of those affected. A chronic disease such as OI can result in anxiety, low self-esteem, and fear of early death. This foundation was created in 1970 and has since raised over $3.3 million.
Young Malaya shares her life story and how OI has affected her. She has suffered from 34 bone breaks, but that doesn't stop her. Malaya continues to live a normal childhood. She loves to swim, draw, and much more. She is proof that even with OI, you can still live a happy and successful life.
Thanks for watching. Kisses. Mwah.